community mental health care is gaining importance here as more people in Singapore seek treatment for mental health issues. Last year, the Institute of Mental Health saw more than 37,000 patients. That's an increase of nearly 5% compared to some 35,000 patients the year before. Now, the top three most common disorders are schizophrenic disorders, depressive disorders, and reaction to severe stress. In the last few years, the Health Ministry has rolled out pilot projects like, for example, specialist-led teams in polyclinics. So we asked you on Facebook if you think enough is being done to educate people about mental health issues in Singapore, and here are some of your responses. Pamela here says no, because she thinks that more education is needed, not just in schools, but in community clubs as well, so the wider community. Well, Amelia agrees that more can be done. She thinks Singapore should perhaps maybe learn from other countries which have been a bit more successful in reducing the stigma attached to mental illness. Oh, this one from Loretta says that not a lot of people consider the fact that a large group of functional adults struggle with a range of mental health issues that are often overlooked, and they may not be classified as more extreme cases, but given the large number of people that this affects, she wonders what society can do to make it less of a taboo. So to discuss these issues, and the issue in particular was recently raised in Parliament by Associate Professor Fatimah Lateef, MP for Marine Parade GRC. Well, she's here in studio today with Associate Professor Daniel Fung from the Institute of Mental Health. So thank you both for coming in today. So perhaps we'll respond to that question, the societal social stigma or the social stigma linked to mental illnesses. Would you say that it's improved over time in Singapore?
I think social stigma is something that will stay with mental illnesses, but what we can do is actually to help reduce it. And that's what we've been doing in the community at Geylang Serai. We've had a lot of programs and also outreach and educational sessions to help people understand more so that they don't treat these people badly.
Okay. You brought up the issue recently in Parliament. So what have you observed in your constituency that, made you concerned about it?
Right. Actually, there's more manifestations that I see during my house-to-house visits, and these people are actually not coming forward for treatment because they do not realize that they have a problem. So when I make my observations on the characteristics, I actually will make the referral, and we try to reach out to the family and also these people as well.
So Dr. Fung, is this something that you're seeing as well, people not being aware that they have a problem?
Well, I think one of the problems is that people are aware, but stigma actually makes them hold back and not seek help until it's very severe. Actually, there are two groups of mental health disorders. One group is much more common but less severe, and then it proceeds to the more severe but less common conditions like schizophrenia, for example, where it's highly stigmatizing and people tend to seek help late.
Actually, I was kind of surprised to find that it was in the top three. So schizophrenia, depression, and severe stress. Those are the top three ones in Singapore.
That's been seen in IMH.
Okay.
But the top condition, I think, is more related to anxiety and depression, stress-related problems. Those are the more common conditions.
I see. So what proportion of those would you say seek treatment late, and is that a problem that needs to be addressed?
They do seek treatment late because, again, the whole seeking of treatment for mental illness has always been a stigma. And I think education is one way to reduce stigma, but the other way, I think, is to help people to be more sensitive about using words that are stigmatizing. For example, saying xiao or going crazy. I think those are things that are important, and we should be more sensitive in using those terms.
Okay. Professor Fatimah, you're a very strong proponent of education and outreach, so perhaps tell us a bit more about what's happening in Geylang Serai.
Right, we've got the Psychological Outreach Program Group, we've got PECS, the Psychological Education at Geylang Serai, where we specifically reach out to parents and also our PCF teachers to teach them about recognition of symptoms, early symptoms. And also we've recently just launched a task force for mental wellness at Geylang Serai with over 10 partners. And I think these are all programs that are going to be very proactive in reaching out to people, identifying symptoms and signs, educating, and also hopefully create more awareness, because I think we need to destigmatize the mental health issues throughout the community.
And Dr. Fung, on the part of IMH, how are you trying to make mental health a bit more accessible to the community?
Well, accessibility is two ways. I think one particular way is to provide the service outside of hospital settings in the community. So we've gone to schools, we've gone to the workplaces, we've gone to where people are to try and provide services. There's a whole slew of sort of interventions that can be now provided in the community.
So you mentioned schools, so most people would assume that mental health issues affect adults or elderly people, but are you seeing more cases of younger people coming to you for help?
I think a lot of young people may have issues, emotional issues. They are of the mild nature, and that's where in schools, every school has a school counselor that they can seek help from, and they don't necessarily have to seek help from a specialist, from a doctor.
Okay. Dr. Fatimah, you mentioned that you recommend cases that you find in your constituency to polyclinics or to doctors. On average, how many would you say you recommend on a monthly basis or in a year?
Now, it ranges from maybe about 2 to 5 in a month, and it depends because they are of different severity, and also sometimes they are sparked off because of house visits or complaints that I get, neighbor disputes and so on, and actually there's an underlying psychological or mental health issue in that case.
So being a bit more proactive on a grassroots level will help to actually get the message out and help people to become a bit less reluctant to come forward.
Right. And coming forward doesn't have to be always coming to the hospital. You can go. We now have a GP partnership program. There are doctors in the primary care that have training and are able to sort of help with basic mental health issues.
Okay, Dr. Fung, one last question. You've made progress on the National Mental Health Blueprint from 2007 to 2012. So after this, what's next?
It's really equipping more of community agencies like polyclinics, having linked services in the community with what is existing, for example, a family service center or a senior activity center that could also look at this. When people go for these services, they actually have a mental health component that is incorporated.
Okay, interesting. Thank you very much for coming today. It was great speaking to you both. And that was Professor Fatimah and Professor Fung on what's being done to better reach out to help those with mental health issues here in Singapore.